I'm Dr. Blanche Grube. I'd like to have a little discussion with you now about insurance, or what most people call dental insurance. I have many patients after they've received their treatment plan, they've looked at their options, and we've looked at finances. They begin to mull over in their mind, just how much of this am I actually going to have to pay, and how much is my insurance company going to pay? So inevitably they will ask me the question, Doc, how much of this is my dental insurance going to cover? I always get a little chuckle over that, because the truth is there's no such thing as dental insurance. Let me first explain to you what insurance is. Insurance is, wow, my house has burned down. I need a new house. That's insurance. Insurance is somebody totaled my car. I need a new car. Insurance company pays for that. That's insurance. Insurance is I got an $80,000 hospital bill. Actually, today it would be more like a $200,000 hospital bill. That's insurance. When a company I'm not going to use any names, but when a company says, we're going to give you $1,500 a year for your dentistry, that's not insurance. Let's call it what it is. That's a stipend. Now, so why do they call it dental insurance? I think it's to have people think or get this comfortable feeling that somebody is taking care of them. When the truth is, the best person in the whole world to take care of you is you. The best person in the whole world to make your decisions about what kind of dentistry and what kind of health care, for that matter, you're going to receive is you. Not some executive or not some worker sitting at an insurance company desk. I decided many, many years ago, even before I became a biological dentist, I decided to have nothing to do with an insurance company. And let me tell you a little story. Let me tell you how that happened. I had a patient who had periodontal problem. In other words, the patient had a gum infection. As a dentist with experience, I recognized it right away. I knew what had to be done, and I told the patient what kind of treatment they would need. We submitted all of the treatment to the insurance company. Approximately 6 weeks later, a good month and a half, I received a letter from the insurance company asking me if I would do a very special kind of examination. This was an examination that measured the depth of the pockets. In other words, it measured the distance from the top of the gums down to where the gums were attached to the bone. That's called the pocket in dentistry. They wanted me to measure 6 different points on each tooth and tell them exactly how deep the pockets were. And then they were going to use that information to determine whether or not the patient had an infection in their mouth, in their gums, and whether or not they deserved to have the treatment and whether they deserved to have the treatment paid for by their insurance company. Well, first thing I did was call up the insurance company and ask them if they were going to cover this periodontal examination. I was shocked to hear the insurance company say, basically, hell no. They were not going to cover it. They were not going to contribute any money whatsoever towards this added expense that they were going to have the patient do, just so that they could determine whether or not they were going to pay for the treatment. At that point, I became outraged. How can you ask the patient to have one more test done? How can you ask the patient to justify their treatment when the justification itself cost more money? I decided at that point I didn't want to have anything to do with insurance companies, and that's when I stopped working for insurance companies. You notice I said stop working for insurance companies because the truth is, when a dentist enters into a relationship with a patient, that dentist works for the patient. And the patient is assuming that the dentist has their best interest in mind at all times. It's a very, very sad thing, but I have to say Not all dentists have the patient's best interest in mind at all times. If the patient has insurance, and if the patient knows what their insurance is going to pay for, well, don't you think the dentist also knows what the insurance company is going to pay for? And very often the patients receive as necessary treatment not what the patient needs, but what the insurance company pays for. And I became outraged when I began to see that kind of shenanigans going on within the dental profession. A patient should receive that which they need, no more, no less. It doesn't matter what your insurance company pays for. It doesn't matter if some bureaucrat sitting behind a desk thinks that it would be a good idea for you to have a fluoride treatment every 6 months, whether you need it or not. It doesn't matter. What matters most of all is what you need as a patient. That's what matters, and whether or not the dentist can provide what you need. And then the business relationship, should be between the patient and the dentist. It shouldn't be a third-party decision about what kind of treatment the patient should have or not have. Anyway, those are a few words that I have tonight to say about dental insurance, which is, again, an oxymoron. There's no such thing as dental insurance. And give you a little bit of an idea of how I feel about what is needed when you go to the dental chair. It's a little fuzzy there, and patients have to be very cautious about what kind of treatment they receive. And make sure you ask lots of questions. Make sure that you receive what you need and not necessarily what your insurance pays for or what the dentist thinks is a good idea that you should have.